First, the diagnosis of arthritis. The diagnosis is made first with how the symptoms are. Pain is the most common symptom. Generally, pain is located over the front, side, or back of the hip and can be more generalized and deep and radiate down the thigh to the knee. Pain is usually worse with increased activities, but can also evolve into being present at rest. The pain is usually an achy, deep ache type pain with sharp stabbing pains occasionally with increased activities. Pain usually starts fairly insidiously, but can be commenced by an event, a fall or a twist or an injury, and then just gradually evolves. Usually the evolution of arthritis is one where things slowly evolve over a period of time and then start to evolve more rapidly, and the joint can repair itself to a certain degree and keep things at bay for a certain period of time, but eventually the repair mechanisms are overcome and the hip becomes very painful quite quickly. In terms of physical exam, first of all, the way a person walks is quite helpful. Looking at how the leg is weighted or not, how the motion is restricted while walking. Examining the range of motion is very helpful. The restrictions in motion is quite helpful. The extremes of motion are usually always the first to go, and deep flexion, bringing the knee up deep into the chest and towards the other side, can often be quite painful in early arthritis and particularly in later stage arthritis. We look at tenderness around the hip, malalignment, leg length changes, tilting of the pelvis, low back issues as well, curvature, and try to take all of these into account when evaluating a person with arthritis of the hip. X-rays are very helpful just to determine the joint space narrowing that's occurred. Joint space narrowing, once it does occur, is a fairly late stage of arthritis. It generally indicates that there's more generalized severe cartilage damage that's allowed the bones of the joint to move closer together. MRI can be helpful in earlier stage arthritis where there isn't joint space narrowing. An MRI can show us changes in the soft tissues around the hip, increased fluid, and also cysts or holes in the bone or femoral head that can occur as time goes on with cartilage damage.